Hello and welcome to today's webinar, Cosmetic Dermatology for Men, sponsored by Elsevier's Clinics Review Articles and Dermatologic Clinics. Please note your line will be muted for the presentation and the presentation will be recorded. You may submit questions at any time using the Q&A feature located on the right. Today's presenter is Dr. Neil Sadick. Dr. Sadick holds board certifications in internal medicine, dermatology, cosmetic surgery, hair restoration surgery, and phlebology. He is one of the world's most respected dermatologists and is the medical director and owner of Sadick Dermatology, as well as director of Sadick Research Group, which runs multiple FDA clinical trials each year. Dr. Sadick is the clinical professor of dermatology at Weill Medical College of Cornell University and serves on the board of directors for the American Academy of Dermatology and Noah Worcester Dermatological Society. He is president of the International Society of Dermatologic Surgery and past president of AACS, ACP, and CFF, and has served on the board of directors of the American Society of Dermatologic Surgery and Women's Dermatologic Society. Dr. Sadick is actively involved in various research projects in the areas of fillers, toxins, cosmetic dermasurgery, phlebology, cellulite, adipocyte structure and function, stem cells, and lasers. He serves as associate editor for the American Journal of Cosmetic Surgery, the Journal of Cosmetic Dermatology, and the Journal of Drugs in Dermatology. He is also on the editorial board of the Journal of the American Academy of Dermatology, Phlebology, Cosmetic Dermatology, and the Journal of Cosmetic and Laser Therapy. Thank you for being with us today. Dr. Sadick, please go ahead.
Pleasure to be here this afternoon. Welcome, everybody. Today's topic is cosmetic dermatology for men. As you can see on this slide, I have no disclosures for this presentation. So one of the great areas of increasing demand has been aesthetic treatments in men. Men are finally coming forward now and are key individuals looking for aesthetic treatments that we can all provide. As you can see here, as you move from 1997, in the last 2 decades, to 2017, that there's a 273% increase in cosmetic procedures for men. And this continues to increase at an exponential rate, even greater than the number of procedures for women, because I think men are coming to the fact that they're living longer, having greater numbers of interpersonal relationships, working longer in the workplace, so they need to look well and good and healthy, throughout each decade of their life as they live longer. Also, in the media, as you can see in various magazines, there also is an increased presence of how men can be treated with the procedures that we're able to perform and why it's an important part of their well-being. And also, we are living in a world of economic prosperity where there are more, again, dollars that can be spent on the cosmetic procedures that we're going to be talking about. All of these reasons have led to an explosion of, again, aesthetic procedures and the demand that men are looking for these procedures in our offices. If you look in the, again, medical literature, there also is a growing validation of male aesthetics. There are more and more articles that are being presented on a monthly basis about these procedures and their efficacy in treating men. What do men want? Well, men don't necessarily want to look that much younger. They just want to look better. This is the cool guy. Men want to look natural for any decade in life. They don't want to look overdone. They just want to have a better aura about them. 4 hotlines for a clear, relaxed, sharp look in men. The areas that are looked at when we examine men are the eye line, the eye zone, the orbital zone. The jawline, another major area that defines men. Men tend to have a square type of jawline, where women tend to have a more angulated or rounded jawline. Also the waistline. I think that, again, men want to have a more sculptured waistline. They want it to be thin but appropriate for the rest of their, again, body structure. And the hairline. We have so many new advanced techniques utilized in men for treatment of prevention of hair loss. We know about minoxidil and Rogaine. We also have PRP now, low energy light, injectable cytokines, and many new, again, agents that are being tested for prevention of hair loss. And we have, again, world-class hair transplantation procedures using follicular unit extractions. We have automated devices. We now have robotic devices. All that can create an extremely natural hairline. So not only can we slow down the hair loss process in genetically predisposed individuals, we can also, again, replace hair in a very natural fashion using these advanced techniques. So men and women, we are sort of the same in some ways, and we're sort of different in some ways as well. Our anatomy and our physiology, our hormonal, again, makeup is quite different from that of women. Again, interestingly, again, that men, although they are increasing their awareness of these procedures, they're still less, again, informed about treatment options that are available for aesthetics. And even when they're aware of this, they're much slower to adopt these technologies, to come into our offices and actually be asking about these technologies. But that is changing somewhat, as I said. There's an exponential rise, again, in these procedures that are being asked for by men and whom are coming into our offices to adopt these procedures. And also another fact is that men tend to talk about this less amongst themselves as well. They're less open about their goals and expectations, not only with us, the physician, dermatologist, cosmetic surgeon, or plastic surgeon, but also amongst themselves as well. So they very often think about these things for a longer period of time before they actually explore them, either through information online, through articles, or come into our offices asking about this. And they're, again, less understanding about what are realistic expectations that can be achieved with these technologies. But that is changing somewhat. There is more open conversation that men are having. It's not as if one goes to a cocktail party where women commonly talk about their laser, their neuromodulator or treatments or volumetric filler type treatments, but it is something that men are, again, communicating more about in 2018. So what's different when you look at the anatomy of men versus women? Well, men in general have less subcutaneous fat than women do. They have a greater muscle mass, some of it related to androgen activity. They have an increased, again, density of vasculature. There's a greater concentration of both small and large blood vessels in the dermis and deeper tissue in men than there is in women. And they have, some people might say men have thicker skin, but that is a fact. Men have a thicker dermis and epidermis as well, and they have increased secretory activity from the pilosebaceous unit, including increased sebum production. All of these differential factors define the physiology of men versus women and need to be taken into consideration when we talk about the various aesthetic procedures that men can undergo. Also, if you look at a man's face, let's look at this diagram and this gentleman as well. It still is a rule of thirds, but if you look at the upper face structures again, men tend to have larger, again, more accentuated foreheads. They have a greater backward slope of that forehead zone in comparison to women, and they have a more prominent supraorbital ridge with flatter, again, types of eyebrows, which is a differentiating factor from the more angulated eyebrow zone and the less prominent supraorbital ridge that's present in most women. Mid-face features, let's look at that central zone of the face. Men tend to have a wider glabella area, and you need to consider this, particularly when you're treating, again, individuals with botulinum toxin neuromodulated treatments, because it may require more than one single, again, injection to address that glabellar zone, particularly if you're dealing with the procerus muscle and the corrugators, which may be larger and require 2 injections to each of those sites. Men also tend to have a wider nasal bridge with a higher, again, nasal radix. They have a more sloped nasal dorsum, and again, a more even ratio of medial to lateral cheek projections than women have, where again, there may be more accentuation medially with more lateral tapering laterally. Let's look at the lower face. Men, as I said, tend to have a more defined mandibular angle. It's usually sharper. Often it's more squarer. Again, less angulated. It's wider. And also, in addition to this more, again, square or, again, non-angulated component, also there's more accentuation or forward projection, again, of this chin zone as well. So, how do we take these physiologic considerations of differentiation, these anatomic, again, factors of differentiating that we've talked about, and utilize them in a practical way when we, again, address aesthetic concerns in men, particularly when using toxins and fillers? And again, a new concept that I'm going to introduce to everybody is the concept of volumetric structural rejuvenation. Let's talk about toxins or neuromodulators for men. Men, as I said, in general, tend to have, again, a greater mass of facial musculature, particularly the frontalis muscle and, again, in the interglabellar zone as well. So we must really customize the treatments, and, again, there may be higher dosage of the toxins that are necessary in treating men than when we treat women, so you need to individualize, again, your treatment type of approach. This may mean that if you use, for example, 40 units of a neuromodulator for a woman, you may need to use 60 in a man because of that greater musculature. And there are financial considerations of this that need to be understood by men who may come in and say that someone spends X number of dollars in their dermatologist's office. Why is mine X plus 10 or 20%? Forehead wrinkles, rhytids. Medial lateral frontalis should be equally treated because it's really even more important. Men don't want that elevation of their lateral, again, eye zone. They want to have a more uniform, again, position of the frontalis muscle, forehead, and rhytids. And again, you don't want to have elevation laterally or eyebrow arching, which can give a feminized type of appearance to men. You want to, again, keep everything on an equal plane, and you want to treat the entire transverse zone in the upper, mid, and lower forehead zones in men, which are somewhat different than women. And again, the distribution of the dosing can be somewhat different as well, as you can see here, taking into account those particular types of, again, considerations. You don't want to elevate those lateral brows. You want to look at the entire musculature and customize your treatment approach with the number of units of neuromodulator based upon that individual. Again, as you can see here, for brow lifts, again, most men don't like significant brow lift elevation. And particularly, again, for periorbital rhytids as well, there may be multiple injection points. Men may have more intense periorbital rhytids. You need to customize your treatment and then induce your, again, neuromodulator unit dosing based on the individual anatomy of that particular person. So, we just published this paper that just came out a few months ago that show both in men and women, but actually is most prominent in men, that there are two different forehead line patterns that can occur. A number of individuals will have a continuation of the frontalis muscle, as you can see in the upper pictures here, whereas in the lower, probably about a third or so will have what's called a bifid frontalis. So actually understanding this will allow you to customize, again, the neuromodular injection pattern and dosage. For example, if you have somebody with a more uniform transverse frontalis, again, you want to have a uniform injection pattern, where if you have somebody that has this bifid pattern, and this was based on our anatomic studies, you may want to have an increase, again, number of units injected into each of those two belly zones of the frontalis muscle, and then have relatively no injections done in the area where there's no frontalis muscle present. So this is a very new finding and should be considered in men and women, but particularly in men as we inject, again, men in the forehead zone. What about fillers again? The most important thing is to keep it natural in men and don't overcorrect. The last thing men want to do is look rounded, and also they don't want to look feminized. They want to have, again, a more normalized type of picture. It's all about what I call the new natural, which is even more important in men. And also remember, as we said, that there is an increased number of both pilosebaceous units as well as increased vasculature in men, so that men may be at a higher risk of bruising. And this is most prominent in the perinasal zone as well as in the periorbital areas where there's increased angiogenic activity and more vasculature. So that's something to be concerned of in men. And you want to be sure you explain to them that bruising is a possibility, as it is in any individual, but particularly in the gender of men, it may be slightly greater than that is in for women. So, with the utilization of these volumetric agents, and again, the concept that I'm bringing forth Filling to me denotes just applying, again, these agents into local areas of volume loss. I like to think of the concept of panfacial structure, what I call VSR, or volumetric structural rejuvenation, which is even more important in men, but important in both men and women, to give, again, structural support to the entire face, as well as giving a very natural appearance, and again, avoiding that rounded type appearance that may occur if you just treat the nasolabial folds or areas of volume loss, which can lead to a rounded or feminized type of approach. So the common goals, again, are to, again, replace volume loss, however, in a structural pattern that I'll talk about in a few moments. And then also, you want to augment masculine facial features and eliminate some of the deeper rhytids using agents you see here on top, such as hyaluronic acid, PLLA, polylactic acid, PMMA, or calcium hydroxylapatite. All of these agents can be used as volume replacement zones for structural rejuvenation in men. The common areas that men come in are very similar to those of women: the tear trough, temporal area, an area that's often overlooked, but again, as part of a panfacial structural program, should be considered. Malar fat pad repletion. Again, periorbital and lip areas are not common, but actually many of my colleagues, particularly in South America, pay increased attention to, again, putting these agents in the periorbital and lip zone, because having a nice, again, natural facial structure while having very thin asthenic type lips is not a very aesthetic approach. So you want to consider lip augmentation in men as you do in women, but with lesser, again, injection of a large amount of volume, just to give some augmentation that gives symmetry to the rest of the facial structure. And also in women and men, we're now seeing an increased utilization of these products for off-face, again, augmentation as well. And two common areas in men that are being looked at are, again, the upper extremities and the abdomen, using these volumetric types of agents. So we published, again, this landmark paper, which I consider extremely important in dermatology clinics this past year. It talks about volumetric structural rejuvenation for the male face. And again, the approach here, as you can see here, in the upper, mid, and lower third of the face, in anatomic studies that I performed with Sebastian Codofana, that there are, again, superficial and deep fat pad systems in those three areas. One area is around the temporal zone, the mid-lateral cheek and soot fat pad, which is in the mid-third of the face, and then you have a smaller fat pad zone, again, in the chin or mentalis area. So we call this technique the bimodal or two-step trivector approach, where we actually put depot injections into the three fat pad zones right above the periosteum in the, again, upper, mid, and lower face fat pad zones. That's step one of this bimodal or two-step approach. Trivector meaning we're putting depot injections right above the periosteum in the areas where the three fat pad systems are. The second part of this bimodal or two-step treatment, after we accomplish that goal, then we go to the front of the table and examine our patients. And even with these deep depot injections, you'll often see, just using a small amount of these volumizing agents, improvement of temporal hollowing. You'll see, again, improvement of tear troughs, elevation of the nasolabial and meliolabial folds without any direct injection into these areas. Then the second part of the treatment is to assess local areas of volume loss, as well as to contour the face, again, a way that's been agreed upon during the initial consultation by both the patient and yourself. So step one, depot injections to the three fat pad zones in the upper, mid, and lower third of the face. Step two, and those are done depot right above the periosteum. Step two, at the dermal subcutaneous interface, or injections to replace areas of volume loss that you notice after the structural injections. Then to create, again, a morphologic symmetry of the face, for example, squaring of the jawline, some nice even roundness, or nice even taper off in the mid-face zone that you agree upon with the patient during the initial consultation to give good facial, again, symmetry and morphology. So this gives you a structural, again, approach to facial rejuvenation that from our research studies has been shown to upregulate cytokine activity of dermal remodeling and give a very natural appearance. This is particularly important in men where, again, we don't want to, again, create roundness or feminization in these areas. And I call this, again, the bimodal trivector approach, and you can read about this in derm clinics as well as in the Journal of Aesthetic Plastic Surgery as well. So here, let's look at some examples. Here's a patient 12 months after 3 treatments of 10 cc's of polyl-lactic acid. You can see some nice augmentation, and again, it's symmetrically balanced. His temporal hollowing is improved. His, again, flatness in the mid-face zone is improved. He has some nice, again, symmetry or a little bit less angulation or a little more squaring of the, again, chin zone as well, and this gives you natural support. Using agents like PLLA, again, which give you long-term efficacy, any place from 15, 18 up to 3 years, again, you can have long-term, again, natural structural support. In a paper that's about to be released, it's in publication in Dermatologic Surgery also, it's known that PLLA from our studies has been shown to improve overall skin quality as well, which is very important in both men and women. Here's another patient treated with polymethyl acrylate. Again, here's 24 months after 2 treatments, a total of 8 cc's. Again, if you look at these patients, the important things I want you to notice is, number one, they all have good structural support, both in the temporal zone, mid-lateral cheek fat pad zone, as well as the lower third of the face. There is, again, natural augmentation or improvement both of the nasolabial folds as well as the tear troughs. So, again, they look natural, they don't look filled, and again, this is a long-term product that can give efficacy for any place from 3 to 5 years plus. So let's move on from these agents to address some of the technologies that can be used after you relax and refill that we've just talked about that address both, again, skin tone texture in men with energy-based devices. And as I said, more and more men are coming in for treatment with these devices into our practices. So I've listed here in this chart, again, from our Dermatologic Clinics manuscript, some of the common technologies that are being used for men, what the technology is, and what the indications. As you can see, both as in men and women as well, IPL, or intense pulse light, is used for pigmentation, skin rejuvenation, overall skin improvement, pore size tightening. Fractional lasers used for, again, righted acne scars, some degree of pigmentation as well. Then we have underneath that some of the common bimodal KTP and DIAG lasers used for vascular issues. Picosecond lasers, which are being used not only for tattoo, again, improvement, but also for what's called laser toning, the ability to improve overall skin quality, collagen production, as well as improvement of pigmentation in a non-thermal, again, acoustic type fashion. And then one of the hot new areas of, again, radiofrequency microneedling. You can use microneedling by itself, but there's a synergistic augmented effect using a combination of radiofrequency with microneedling that is used particularly, for me, it's a treatment of choice for acne scarring, but also is very effective for treatment of skin texture as well when there's some roughness, again, and it can be used in any skin phenotype from skin type 1 to 6 because doesn't recognize melanin as a chromophobe, so it can be used in darker skin individuals, an advantage of over some of the mid and shorter wavelength laser type technologies. So here's a patient treated with a 1550 fractional laser, natural improvement. Again, this is just after a single treatment, 4 months after. Another patient treated with a KTP laser. The KTP laser can, again, target vascularity. It's also improved, again, the lentigo, as you can see on this patient here on the lower cheek. This is a 532 nanometer KTP technology. Here's a patient, again, that has significant acne scars, just using a microneedling radiofrequency technology. And again, this is 3 months after a third treatment with some very nice natural improvement. Interestingly enough, with these microneedling devices, the more treatments there's augmented, again, synergistic effects that occur with these technologies. So this is something that can be very effective, again, particularly in treating acne scars. So let's move on to skin laxity. Men also want improvement of skin laxity, non-invasive fat removal. You can utilize ultrasound, radiofrequency, acoustic shockwave technology, or again, as we talked about, new generation volumetric agents can be used to treat zones in any part of the body as well. So here's ultrasound again, ultrasound skin tightening, focus ultrasound skin tightening. Excellent improvement, as you can see here, on the lower third of the face, and particularly around that neck zone with significant tightening. Here's another patient where we utilize a radiofrequency probe, what I call targeted therapy. That probe is inserted under the skin itself, and this is 3 months after a single treatment section with very nice tightening as well. This is non-surgical tightening, significant improvement after a single treatment session. Here's a patient where we use a volumetric filling agent. Here again, PLLA. This is 1 year after HCC implantation with improvement of overall skin quality. So one of the hot areas that men are coming into our office on a daily basis now is for fat reduction, and this is a major zone that men are looking at now to improve their overall physique. So fat deposits can occur any place. Common areas, the external obliques or love handles, and another area is submental fullness or chin contour as well. And you can see here in the shoulder zone, in the waist areas, what is a very nice symmetric triangle, and you want to be able to accomplish, again, the symmetry with these types of technologies. The technologies that can be used for fat reduction include freezing, monopolar radiofrequency, lasers that do heating of adipocytes, and we are also conducting FDA research on a new injectable bioactive, again, compound that induces a chemically induced septolysis and can be also used to dissolve adipocytes as well. Here is cryolipolysis again, excellent improvement. This is sort of my number one go-to agent for single treatment efficacy, and here you can see very excellent results in both love handles after a single treatment session. What's nice about this, the new technology, there's various pieces, applicator pieces, that can be used to contour almost any part of the body. Again, the most common areas where men come into my practice, is for love handles. The second most common area is abdominal, again, fat deposits. And this is only for superficial fat, not for visceral fat. And the third most common area men are coming in are for the upper extremities, fat deposits and tightening in that area. Remember, there is a slight increased risk of paradoxical adipose hyperplasia after cryolipolysis. It's something that's on our intake form, on our consent. It's something that should be discussed with patients. Here is, we published this article, again, showing that a patient that had this paradoxical hyperplasia in the lower abdomen, this usually is treated by, again, liposuction, under local anesthesia, or you can try one of the new injectable lipolytic agents that I talked about. This is extremely rare, but it's something that can occur, and it should be discussed with patients. With the newer applicators, which have decreased the treatment time from 60 to 35 minutes, I've actually not seen any of these cases over the last year and a half, as I had seen a few, again, prior, that from both my practice and those that were referred for secondary treatment. One of the new kids on the block, or monopolar radiofrequency, has 3 months after a single treatment session. The theoretic advantage of this technology is that it induces both radiofrequency lipolysis as well as radiofrequency skin tightening. So you might have a synergistic type of effect. Studies have been published about this and are now in progress looking at this potential combination synergy between non-invasive fat removal and skin tightening. Here is one again, the 1060 nanometer diode lasers. This is another excellent technology that can be used as well. We use this in our practice. Also, many of the same indications that are utilized for cryolipolysis can be achieved with the 1060 nanometer diode laser as well. Here's 3 months after a single treatment session with excellent improvement. We work with this technology as well in our practice. And again, we also know about the oxycolate, again, this injectable, again, lipolytic agent as well. Here it being used for submental fullness. As you can see here, there are two agents that are being explored now. One is this agent, the oxycolate, which is a surfactant moiety, most commonly used on label just for submental fullness. Other people use it off label for other fat deposit indications. And as I mentioned, there's a second agent called Xiaflex that's in FDA study now that can be used to treat cellulite, septolysis, and potential studies may also look at this for non-invasive fat removal in local areas as well. So we have lots of different treatment approaches for non-invasive fat removal. I recommend, if you're considering bringing these into your practice, have companies bring them in, try it on a couple of patients, decide which one fits best into your particular practice scenario. So let's end with some hair treatments again for men as well. This is an exciting new area now. We have lots of hair removal devices that are being perfected, more powerful, better cooling devices associated with them. We have low-energy laser therapy, lots of articles being published on biomodulation as a mechanism for increasing hair growth, increasing hair thickness, and elongation of the anagen phase. We have platelet-rich plasma, which our research group has been studying again, which takes your platelet and concentrates the growth factors of cytokines, which are re-injected into the scalp. This is an embryonic area that's still in development at this time. And there are some new generation nutraceuticals that have both some anti-androgen, some anti-inflammatory, as well as some anti-holistic stress reduction capabilities associated with them. And as I talked about, there are new, again, automated transplantation technologies, such as the ARTIS robot, the NeoGraft, and the SmartGraft, which is a new one, which, again, has made hair transplantation very efficient and very natural, again, in terms of its efficacy. This is a new generation intense pulse light technology that we use now for hair removal. This is an excellent, very fast and powerful technology with very, again, excellent cooling. Here's a patient treated after 2 treatments with this new IPL technology with excellent results. I'm really excited about this. IPL was sort of forgotten about for a while with diode laser development, but I think that IPLs are gaining, again, a recrudescence in terms of their ability to give effective hair removal. Low-energy laser therapy, again, usually these technologies have, again, wavelengths between 650 and 900. Some individuals think that 800-plus wavelength is the maximal area for efficacy in this. More research is now being done at these new wavelengths. These technologies, again, have anti-inflammatory efficacy as well as some psychostimulatory component, and they are available to use in the office with products such as the Omnilux or at home. There are various technologies such as combs and caps that can be utilized as well. The goal for treating hair loss in men and in women is to be able to target what I call those indeterminate hairs. We have hairs that we know stem cells, again, atrophy, that are lost under genetic influence. Once that happens, the hairs cannot be recruited. Then we have growing hairs or anagen hairs that go through a normal trichoregulatory cycle. But then there's a group of hairs that should be targeted with these technologies and treatments that I call indeterminate hairs that have some degree of stem cell senescence or loss in them, but they still have enough active stem cells where under the influence of androgen and genetics, they can be lost if they're not stimulated. But using, again, PRP, these low-energy light agents such as Propecia, minoxidil in men, and some of the new, again, Wnt inhibitors that are being studied now have the ability to slow down hair loss in genetically predisposed individuals. An area I've been particularly interested in has been that of platelet-rich plasma. Again, what we do is we spin down blood, and then we have on top a sort of yellowish, what I call platelet plasma, again, component. And then we have, again, the concentrated platelets, and then underneath the erythrocytes and leukocytes. And this is done by simply extracting blood and placing it in a centrifuge and spinning it down. There's some question of whether these factors need to be activated by agents such as calcium chloride or thrombin, but many people are not doing this at this time. And again, these injections are injected into balding areas and areas where hair begins to thin. We don't have an exact treatment protocol. We have a consensus panel that's going to be meeting in Dallas over the next several months. But most individuals now, in terms of treatment protocols, do these treatments 3 to 5 times, usually somewhere between 3 to 4 weeks over a period of 3 to 6 months total. And then most people, again, do maintenance treatments somewhere around the 3-month intervals. This can be used as we do in our practice in conjunction with low-energy light sources as well as with nutraceuticals and even with the utilization of minoxidil and or Propecia. And as you can see on the upper right there, again, those are some of the active cytokines that have been shown to stimulate hair growth, again, and sort of recruit these indeterminate hairs that might otherwise be lost under, again, androgenic influence. So, new generation nutraceuticals. This is a new generation nutraceutical that our research group has studied again, and you can see here the active components. So we're not only looking at the 5-alpha reductase story as in the development of Propecia. We're not only looking at just stimulation of stem cells, but we're looking at a more holistic approach to hair loss now, which can include, again, antioxidant treatments, anti-inflammatory treatments, which are particularly, again, important to me from our previous research studies, showing that both in men and women, a subset of individuals have an inflammatory component to hair loss that over a period of time that can lead to microfibrosis and dropout of active stem cells in those so-called indeterminate hairs. Also, this product has as well some anti-androgen component and what's called a stress adaptogen, and there are some people that feel that improving inflammation, improving stress in individuals, protection of, again, hair stem cells via antioxidants to prevent free radical breakdown are an important holistic approach to the treatment of hair loss in men and women. This is a clinical study, again, showing that this type of product, again, has been very helpful in increasing hair number, increased anodization, as well as in hair growth and quality of life. You can see from this, again, recently published study, there was an increase both in terminal and vellus hair counts compared to the placebo, as you can see. So lastly, some of the new advances in hair transplantation. It's all about creating natural hair. In 2018, no one should ever know they've had a hair transplantation. Again, this is the new generation robotic hair restoration device, again, that is able to extract these naturally grouped follicular units in a very automated, again, type of fashion, giving you increased standardization, and it's rapid, and it provides these grafts in a very reliable and standardized type of fashion. And most importantly, compared to hand, again, removal of follicular unit extractions using hand engines, again, it's been associated in studies to have a lower transection rate of the hair follicles, which might not grow. So, new hair transplantation technique, again, is about follicular unit extraction. That is removal of natural embryonic units of hair follicles. So, again, that there is no scarring. Again, these natural units are able to grow with a much higher, again, frequency than previously when using just hand removal of these units led to increased transection of hair follicles. Here's another new device. It's an automated device that removes, again, these follicular units in a very automated type fashion, also being used by some individuals throughout the U.S. and around the rest of the world. Here's natural hair transplantation from our group. Again, no one should know the procedure was ever done. It's about increasing hair density in a very natural type fashion. So in conclusion, I'd just like to say that we've talked about the fact that men have a somewhat different anatomical considerations and physiology and goals, and the way they think about and discuss, again, treatments for aesthetic augmentation and improvement. Even more so than in women, but in men and women, they want to look natural. It's about the new natural. It's about, again, safe, minimally downtime, natural type of approaches to whole body rejuvenation. Also, as I've said, combination approaches using both internal and external technologies for whole body rejuvenation is sort of a new concept that may lead to improved or increased synergistic efficacy in treating men. Again, there are more high-level evidence-based studies that are now underway in men. Many have been completed in women, but showing that men can have excellent efficacy and improved quality of life using these new aesthetic treatments as well. And as I mentioned during my initial slide, that the male market is the highest growing patient group for aesthetic procedures, and we are going to see these patients coming to our office with increased numbers and frequency as we move through the next several years. So I'd like to thank you so much for your attention, and I recommend you look at, again, a couple months ago, dermatology clinics and advances in dermatology. We've had, again, various issues that have been published looking at male aesthetics, and they include a lot of the information that I've discussed during this webinar. So thank you very much. Have a great day.
Thank you, Dr. Sadick, for sharing your expertise with our participants. I'd like to open our question and answer session. If you'd like to submit a question via the Q&A box, you may enter it now. Here is our first question. It reads, "It is only recent that men are more open about getting treated and seeking aesthetic treatments. What are the best strategies to help your male patients open up and share their goals about improving their appearance?"
I think some of the best strategies that we're looking at are having some of these, again, communications in our office. We have it on our office loop that talks about aesthetic procedures. We have some of the publications that we publish through our research group and in various dermatology and cosmetic surgery publications, magazines, and volumes. And this allows, again, increased understanding and increased connection of our male patients with these treatments being available. And also, every time somebody comes into our office, if they come in for a medical concern, we also, on our patient intake, as well as during our initial discussion with our patients, ask them whether they have any aesthetic concerns related to this factor. You need to begin the conversation more in men than you do in women, and that's one way that increases, again, interest of men in talking about these procedures, inquiring about them, and ultimately adopting these procedures.
All right, thank you. We have another question that came in, and it reads, "There are many new treatments for treating hair loss. Do you think we are coming closer to curing hair loss disorders? What do you typically advise your male patients for hair growth?"
That's a great question. Are we coming closer to the ability to cure, again, androgenetic alopecia in men? Probably not. There are, again, a number of new drugs in development, but I think the hottest new areas that have been shown to be most effective, other than the standard treatments, which include Propecia and minoxidil or Rogaine preparations, is this combination approach of utilizing PRP, which has its trichostimulatory cytokines in it, as well as low-energy light. And I like also using a combination of high-dose minoxidil with a low-potency topical steroid, because I do believe that inflammation is a factor in hair loss in both men and women. So we're not there yet in terms of being able to cure, again, common male baldness, but again, the things I think that are most helpful are, again, these stimulatory agents, PRP, low-energy light, these new generation nutraceutical derivatives as well that are out there, such as Nutrafol. There are several, but that's a common one that we've studied, are also very helpful in this setting. And remember that hair transplantation now is almost perfected. Again, you can create almost natural density that you had prior to losing your hair, again, in a very minimally downtime, non-invasive type of fashion, using these new automated technologies that are available in this regard.
All right, thank you. Unfortunately, we've run out of time for questions. We would like to thank Dr. Sadick for presenting this exciting informational webinar activity, and we hope that you'll be able to use what you learned today in your area of practice. At this time, I would like to thank our presenter and today's audience for participating in our webinar. Thank you for joining us. I hope to see you at a future webinar.